A patient who has been on TB medication for almost 6 years has been declared TB-free by the Moi Teaching and Referral Hospital. 29-year-old Samson Kibet had extensive drug-resistant TB. He's the third person to be treated with XDRTB in the facility. As Emily Chebet reports, Samson had been admitted 3 times, the last admission seeing him spend 2 years in hospital. He was allowed to rejoin the community and escorted back by a team of medics from MTRH and partners like Ampath and Center for Health Solutions Kenya.
29-year-old Samson Kibet sat his final secondary school examination in 2015 with a lot of hope about the future. Little did he know that life would take a different turn. In June 22, 2018, Samson's dream of becoming a teacher was dimmed after he was diagnosed with tuberculosis that would see him in and out of hospital for more than 5 years.
Ilikuwa ni ile TB ya kawaida. Nikameza hizo madawa za miezi 6. Ni kama ikaresist. Ikabidi sasa wametuma hizo hospitali mama sijui inaitwa Kalja. Ndio results ikatoka sasa nikakuja nikadmitiwa hapa hivi 2018 October.
Kibet was initially diagnosed with drug-susceptible tuberculosis, but illness stubbornly progressed for pre-extensive drug-resistant TB. The disease would defy treatment efforts twice, finally morphing into extensive drug-resistant TB. Immediately after the diagnosis in 2018, Kibet was admitted at the Moi Teaching and Referral Hospital for 9 months before he was discharged. But upon completion of 18 months treatment at home, the infectious disease relapsed and he was readmitted at the same facility for 11 more months. He was again discharged, only to be readmitted for the 3rd time with extensive drug-resistant TB.
Sielewi, sijui shida ilikuwa wapi, ndio hiyo dawa haikuwa inafanya kazi. Sasa wakanibadilishia dawa, haikuwa inafanya kazi. Ikabidi sasa niliambiwa wewe uko na ile TB sugu. Sasa lazima upelekwe isolated. Isolation yani.
While managing the drug-resistant TB patients, we have several challenges. First of all, the treatment duration is quite long, and patients often get tired of the medication because unlike the first-line TB treatment that takes 6 to 1 year, this one takes almost 2 years.
Extensive drug-resistant TB is a type of TB that is resistant to the most potent TB drugs, both first and second-line treatment. Samson has been on 2 injections every day for 18 months and 3 doses of oral treatment for the same period that he has been admitted at the Moi Teaching and Referral Hospital. According to the medics, TB patients who are admitted are those who are very sick, who have shortness of breath, who cannot carry any activities, patients who have other illnesses like TB and anemia, other chronic conditions like asthma. Some have cancers and TB. Patients who are highly infectious and can pose threats to the community. Patients who take alcohol and drug abuse because of the issue of adherence, street or homeless people. This, they say, is part of the strategy to reduce TB transmission within the community.
Wakati niliambiwa ati TB yako ni sugu, ilinisumbua sana, lakini sasa unajua hospitali kuna manurses wa karibu, kuna hao matherapist, kuna hao wengine macounselor wanakuja. Hao nayo wanasaidia sana. Wanakuongelesha unaelewa mpaka unajikubali. Na ukishajikubali basi dawa hata nayo inakubali.
We actually went out to TRT where he comes from. We went out to Kacheliba and Transoia, places he has been, and we went all those places and screened everyone. So if you do early screening, you pull out patients with TB from our communities, you put them on treatment, then that is one way.
Samson is being discharged a 3rd time from this facility after 2 years in hospital, one of the longest periods he has been in isolation. Moi Teaching and Referral Hospital team celebrated his discharge even as they prepare to accompany him back home in West Pokot for the first time in 2 years.
Ikifika wakati unaambiwa unadischargiwa, kabisa yani niko na furaha by niko na furaha.
This patient finally received his results to have been negative, and we really appreciate the national program, Ampath and CHS in terms of sample networking for culture and other tests to the Lancet lab, which could not be done within the facilities.
We would not want to really be celebrating taking care of TB. We would want to be taking care of things that we cannot prevent. So TB is one of the things that we can prevent, as Prof has said, and let's ensure that we prevent TB, we prevent opportunities for spread, especially by early diagnosis.
You can imagine 2 years being away from home and not knowing exactly what is going on in the village. So the team sat down, the social work team, and they planned that they would escort the patient to the community.
Song and dance back at home in Kacheliba, West Pokot County. Friends and family welcoming back one of their own who have been away from them for 2 years. A cousin who is also a nurse at Kacheliba Sub-County Hospital recalls the stigma they went through after Samson, who was living with her family, was diagnosed with extensive drug-resistant TB.
Tulipata stigma sana. Baka like msiende kwa ile nyumba kucheza watoto, kila mtu alikuwa anatuona ni kama we are kind of tulikuwa secluded, and that forced me kuhama huko.
Baada ya saa hii nimepona, nasikia afya imerudi, so I think ni kuendeleza masomo tu ya mali niliachia.
Extensive drug-resistant TB is a rare type of TB. Samson is the third person to be diagnosed at Moi Teaching and Referral Hospital. According to medics, frequent screening and early diagnosis will accelerate the fight against the infectious disease that is treatable, and its treatment is free. Emily Chebet, Citizen TV.